With the recent decision by the U.S. Supreme Court on health care, there's going to be big changes in Hawaii and elsewhere throughout the country. Today we have two people who will share their expertise on how that's going to impact Hawaii and the rest of the country. I want to welcome Charles DeJoux, who's a congressman from 2010, and also Dr. Joseph Zobian. He is the president of the Hawaii County Medical Society. Thank you for joining us today.
Thank you for having us.
Thank you for having us.
Okay, first, Charles, you've been on the show before. Welcome back.
Thank you. Thank you for having me.
Okay, so tell us about, you're a lawyer, so you have a little bit of an insight maybe that we might not see on the U.S. Supreme Court decision.
You know, I respectfully disagree with how the Supreme Court reached what I believe is a fairly tortured analysis of the health care bill. But I think the more important point is that this particular piece of legislation was bad policy last month, and it's still bad policy this month, irregardless of how the Supreme Court ruled on it. I am glad that at least the Supreme Court stated that the Commerce Clause does have some limits, or does place some limits on Congress, that Congress cannot regulate anything out there. But as far as this health care bill is concerned, it is now clearly a tax, as has been ruled by the United States Supreme Court. What I find interesting about this is that all throughout the debate of the health care bill, repeatedly Congress said, it's not a tax, it's not a tax, it's not a tax, and now lo and behold, it's a tax, and it's a $500 billion tax, the largest in American history. But also, I think what should be interesting for people to understand is because it's a tax, to repeal it, you don't need to overcome a Senate filibuster. The United States Senate rules, you only need a simple majority to pass budget bills. But I think the more important point here is what makes sense, what's good for the American people. I do agree with President Obama that we do need some form of health care reform. The problem is I think the way Congress is going about it is all wrong. I don't hear anybody saying that when they go see the doctor, the problem with healthcare in America is a lack of regulations. I don't hear everybody saying, well, gosh, the last time I went to the doctor, there just were not enough paperwork for me to fill out. But this is exactly what this bill does. It adds more layers of regulation. The problem with healthcare in America, I believe, is its cost. As a percentage of GDP, we Americans spend more on healthcare than any other Western country, and our costs are rising. And because of that, too many Americans aren't covered. So the way to address it is let's find out a way to make healthcare more affordable for Americans. And the way we should be doing it, the right way to reform healthcare, starts with tort reform. Medical malpractice insurance is, for many doctors, the single largest cost and expense of practicing medicine, and the fastest rising cost. That's the right way to reform healthcare, not the bureaucratic monstrosity that we have today.
Okay, we definitely want to talk more about that on solutions and things like that. But tell us, Dr. Zobian, you were shaking your head yes in agreement with several of the things Charles said. So tell me, what is your perspective on the ruling, and how do you think it'll impact you and your patients?
Well, you know, I'm so glad to be here with Charles. He's Congressman DeJoux is one of my heroes. And I'm sitting here listening to him, I'm thinking, oh, I don't even need to be here.
You do, though, because you have a special perspective.
Well, I'm actually in the trenches. You know, he's been in different kinds of trenches.
Yes.
The trenches I'm in are the healthcare, actually the practice of medicine. And you know, I've been practicing for about 15 years now, so I've seen it change. And my father's a physician. He's seen a lot of change. He's still practicing. So he went from the time when Medicare was just coming in. And at that point, they got the camel got its nose under the tent by really paying big fees. And they entice the physicians by telling them you can actually charge what you want. And of course, you know, that eventually changes. And whenever the government takes over any industry, they come in with a lot of money and then things change. And so what we're looking at right now, and it's interesting because the Affordable Care Act, a lot of that stuff we're already doing here with the Prepaid Health Care Act. And Hawaii has a lot of people that are covered. But one of the problems Hawaii has is that we're losing physicians. And so this Affordable Care Act is being marketed as something wonderful. We're going to get everybody insurance. And that's great. But one thing we forget is just because you have insurance doesn't mean you're going to have a physician. Especially in the neighbor islands, we have these terrible physician shortages. Why? Well, there's a lot of reasons, and it's quite complex, but a big part of it is that it just doesn't pay to practice medicine out there. And that's sad, because there's so many people that need care. And so what's going on here, and to be honest, I do have a bias. I really think that the problems we have in medicine are, to a great extent, due to the government interfering and the whole concept of third-party payers. And so what we're doing is the Affordable Care Act essentially doesn't really address the problems. What it does is it doubles down on the causes of the problems, which is insurance and the way we finance it and the way we regulate it. And just as Charles was saying, I don't think any patient's ever gone into their doctor's office and said, oh, he didn't spend enough time staring at his computer doing his paperwork. But a lot of us are doing that now. And the administrative work that we're doing, every moment we're doing administrative work, every moment we're dealing with an insurance company that's giving us a hard time, every moment that we're dealing with an insurance company that won't cover the medication that we need for our patients, and that happens a lot, is a moment we're not doing what we love to do, which is take care of people. And so what you're seeing medicine becoming a less gratifying, less pleasant profession in light of growing need, okay, and in light of a situation where we have our population is growing, and especially the aging population, they're consuming a lot of health care. So we're sort of watching demand go up and supply go down, and it's becoming a crisis. And just ask anybody who's living on the neighbor islands.
Now, we could see things change, right? With this election, we have President Obama who wants to keep things the way they are, and Mitt Romney who wants to change the way, change the whole healthcare. But what if that? So, say the election, doesn't go the way of President Obama. How is that going to affect Hawaii?
Well, actually, Malia, I think that's why this election is so very important. The majority of the mandates, the regulations of the Affordable Health Care Act kick in actually in 2014. Once they kick in, once any sort of bureaucracy and regulations begins to drill its roots into American society, it's very, very difficult to pull out. One of my favorite quotes is from Ronald Reagan, who said, "The closest thing to eternal life we've ever discovered is a government bureaucracy." That's why this coming election is so important. If we want to reform healthcare the right way, we're going to have to do it after this upcoming election. And who we elect to serve in Congress and who we elect to put into the White House is going to make a huge difference. Because if we don't change this Affordable Health Care Act and we just continue to expand the size of government and regulation in the healthcare industry, these problems we have of lack of physicians, these problems we have, the breakdown of the doctor-patient relationship that Dr. Joe Zobian has explained, are going to come to fruition. It's all going to depend on this upcoming election. That's why it's so important that people pay attention and do participate in their democracy.
Now, one of the things I noticed with the health care bill is how many taxes there are that kick in 2000, I think it's 14 and beyond,
yeah.
right?
Yeah.
And so has anyone followed that in terms of, have you followed that in terms of what kinds of taxes are going to be imposed?
Well, the cost of this bill, as pointed out by the Supreme Court, this is a $500 billion, $500 trillion. I need to add 3 more zeros there.
Right.
$500 billion removal from the American economy to go towards government bureaucracy. To begin with, anytime you move that enormous amount of sum from the American economy, that isn't a good thing. What's even worse about this particular piece of legislation, it's doing that to foster and create a gigantic bureaucracy that will ultimately do harm to the healthcare services and provisions of healthcare to the American people. And that's why I think it's so important that we reverse so many portions of the Affordable Health Care Act. And let's reform healthcare, and let's reform it the right way.
Maybe you can give us a perspective from your work. And when you go to work in the morning, how does it go for you? How much paperwork do you have? How many patients do you get to see? What's your day like as a doctor?
Well, I'm a specialist, so I have sort of a unique experience. And I mean, I experience a lot of the things that the primary care docs do, but they've got it pretty. I mean, I think they're the ones who really struggle the most. A lot of the older docs, especially, they work off paper, and paper charts have worked so well. With the current environment, we're being penalized if we're not using electronic medical records, if we're not using what they call e-prescribing and these things. A lot of the older physicians, they are not that interested in converting over. It's a very expensive and a daunting prospect. And so, I mean, I hear all kinds of things from them, and that's a problem. For me, not so much as I'm sort of in the younger generation, comfortable with computers. When I opened my practice, I went straight to electronics, so that helps. But a lot of the things that we deal with now are dealing with insurance companies telling us what we can, what we can't do. And then what happens is if an insurance company tells us we can't do this for the patient, we sort of get caught in between. And the physicians get caught between patients who have paid for their insurance or the Medicare patients patients who've been paying their entire lives, they want to know why they can't have this done. They want to know why they can't get this medication. And it puts us in this bind. My friends who are psychiatrists, that's a real problem because they deal with a lot of Medicaid. And their patients who need specific medications can't get them. So they have to call the insurance companies, they have to deal with this, they have to practically beg and plead on behalf of their patients. It becomes demoralizing. They don't have that much time. Every moment they're spending there, it's not with their patients, it's not with their family. Medicine is overregulated. Government is doing too much. And the physicians are getting caught in the middle, and it's wasting our time. And so, unfortunately, a lot of the physicians, psychiatrists, primary care doctors, their practices are becoming saturated. They're not so inclined to take care of the Medicare and Medicaid patients. They want to. Physicians, we became physicians to help people, but the reality of the situation is that the insurance companies, the government's become so overbearing, we're getting caught up. We can't provide the care that we want to provide, and the care that our patients deserve and expect. And that's part of our daily reality, and it's getting worse and worse. And the Affordable Care Act is going to double down, like I said, it's going to double down on the misery for physicians.
Charles, take us back to how this bill got developed, and were you paying attention to Congress at the time? You weren't in Congress at the time, but...
Actually, I was running for the
You're
U.S.
running
House.
okay, so...
The Affordable Health Care Act passed just a few weeks before my election to the U.S. Congress.
Okay.
But it was an ugly process, clearly. In order to get this thing through, so many inside deals were put together to make this legislation passed. There was the so-called Louisiana Purchase to get Louisiana Senator Mary Landrieu, get her support. They packed in billions of dollars of additional Hurricane Katrina relief into this bill to earn the support of Nebraska Senator Ben Nelson. They threw in extra dollars for Nebraska, nothing to do with healthcare reform, everything to do about insider politics. All the more reason why this legislation isn't appropriate for the American people and why we really need to correct healthcare properly. Because, Malia, I really want to convey here that I don't disagree that there is a need to reform healthcare in America, that there are right things that we can do to make the provision of healthcare better for all Americans and for the people of Hawaii. Where I disagree and where I have a problem with is that this particular bill doesn't improve things, it actually makes it worse. Adding on layers of bureaucracy, as Dr. Joe Zobian was just explaining here, is the worst thing to do. It further separates the relationship between doctors and their patients. I mean, the best person who understands what to do with your own individual healthcare needs is you, and your consultation with your own physician. Having some bureaucrat in Washington, D.C. try to dictate to you how your medicine should be taken, what kind of medical care you should be provided, makes no sense. And it's making the quality of care worse and still very, very expensive.
It makes it more expensive. Yeah. These so-called cost-cutting measures, if we look at it in the long run, we're going to look back and say, it really increased the cost. Look at, just when they passed the Affordable Care Act, health insurance premiums went up significantly, more so on the mainland than here, because we sort of have a lot of the provisions, these provisions already in our Prepaid Health Care Act. But on the mainland, premiums went up. This whole thing, and what really sticks with me is, this is a difficult issue, but the pre-existing condition issue. Now, we don't want anybody to go without medical care. The Affordable Care Act says that no insurance company can deny coverage for a pre-existing condition. And that sounds like a really good idea. Just like most of the Affordable Care Act, it sounds like a good idea, and a lot of it is well-intentioned. However, and we can probably get into this later, what people are going to do is, if you can buy insurance at any time, no matter whether or not you have a pre-existing condition, what are people going to do? They're not going to carry insurance until they get sick, until they, God forbid, have that car accident or are diagnosed with cancer. The insurance companies are not going to be able to handle that. And to be honest, and this might sound a little jaded on my part, I think a big part of the Affordable Care Act is a desire to drive the private insurance companies out of business, because I can't see how they can remain viable in that kind of an environment.
So if that happens, because I've heard that before, I've heard that argument before, then what would happen? It would be government insurance, right?
And I think that, to be honest, I think that's the ultimate goal. The ultimate goal of the Affordable Care Act, I think it's a stalking horse for socialized medicine, for so-called universal payer, which is essentially give the government all your money for medical care and they'll finance it for you, and you just have to trust them to pay for it, and the doctors just have to trust the government to pay for their services. And I think that's where this is going. It's inevitable.
Charles, what are the issues came up that a lot of people hadn't even read the bill before they voted on it? Tell us about what do you remember about that?
Actually, you're exactly right, Malia. When Congress passed this piece of legislation, it was done in the dead of the night. Members were only given a few minutes to look at the bill. 2,700 pages. And it was just rammed through. I think the best quote about this particular piece of legislation came from then House Speaker Nancy Pelosi, who said, well, we have to pass it to know what's in it. And now that we know what's in it, we see that this is not the right prescription for the American people. But Malia, if I could real quickly put in, I do want to offer here solutions.
That's
because
good.
I realize that we can criticize this legislation, but also we have to make sure that we find right ways to actually fix these problems facing the American people. For myself, there are 4 solutions that I think should be looked at but are not contained in this bill. 4 common sense steps to help improve healthcare in America. Now, I mentioned one already, and that's tort reform. Medical malpractice insurance is rapidly becoming the single biggest cost for practicing medicine in America. Is the fastest growing cost for many physicians. Too much of our medicine today is defensive medicine by doctors to try and prevent lawsuits. That doesn't make sense. We need sensible tort reform. Number 2, I think we need to expand the use of medical savings accounts. For most people in Hawaii, you're probably more familiar with it as flex spending accounts. That's the right way to do things. Put the money in the hands of individual patients and let them decide how to use their money and their resources on the care and provision of medical services. Number 3, I am a champion and supporter of interstate sale of health insurance. Any health insurance company that is validly licensed in any state should be allowed to sell their insurance any state in America. For us in Hawaii, 90% of all health insurance is covered by just 2 private companies, HMSA and Kaiser. That doesn't afford real competition or a reduction of any prices here. And I don't think that's a good idea. And last and finally, for those in the GAP group, the individuals who are earning too much money to get Medicare or Medicaid, but not enough money to afford health insurance on their own, for that small group of individuals who are in that so-called donut gap, I do support some form of tax credit to allow them to purchase their own health insurance. And that's going to be something that's far cheaper than $500 billion as currently suggested by the Affordable Health Care Act. These are the right ways to fix health insurance in America. They will provide real, meaningful savings for our nation. It will provide more coverage and strengthen the doctor-patient relationship and continue to provide high-quality health care to the American people. The way we're currently doing here, by expanding the bureaucracy, enlarging government regulations, is the wrong way to do it. We're going to destroy everything that's good about medicine in America without fixing the problems.
So in terms of what we can actually expect to happen, do you think that any of those ideas have a chance?
I do, but it's all going to come down to this upcoming election. If we don't change the direction of Congress, if we continue going along the same path that we're going on right now, we're going to get the Affordable Health Care Act because all those provisions are going to kick in 2014. On the other hand, if we make a change in this coming election, and I think the American people are seeing this and understanding this, then we can finally put in some of these sensible reforms and fix healthcare in America the right way instead of the way we're doing it right now.
So let's take your 4 issues and how about commenting on tort reform? How does tort reform impact you as a doctor?
Well, I just want to say that I can't wait to vote for Charles.
Charles is running, by the way,
I want
for
to
people
beg
that
the
don't
people
know
of
that.
Hawaii to send this man back to D.C.
Thank you. I didn't pay him to say that, by the way.
No need to pay me for that.
But he is, Charles, you've been on the show before because you are running for Congress again.
Yeah, I am, in the 1st Congressional District.
That's
again.
right, that's
Yeah.
right. So that your election will be up in
This coming November, yes.
November, yes, okay. So what about that, tort reform? Tell us how that will impact you.
Tort reform is a big deal. Tort reform is a much bigger deal for those specialties that are particularly prone to lawsuits. Neurosurgeons, trauma surgeons, OBGYN. And not incoincidentally, those are the specialties that are in greatest need because these folks, they get sued so often. And so they're carrying malpractice policies that are that can be hundreds of thousands of dollars a year. It's unbearable. So these folks, what they end up doing is they end up migrating to states where they've already instituted tort reform. And so that does more so in certain specialties than others. But it would be absolutely critical because he's absolutely right. Charles is absolutely right. Defensive medicine is expensive medicine. It's wasteful medicine. And to be honest, we all sort of think when we're dealing with a patient, in the back of our mind is, are we going to get sued? And that creates a disinclination also to take care of particularly sick patients, which we don't want. This whole thing, right now we're dealing with this pay-for-performance thing where insurance companies are going to come and watch our outcomes. Well, physicians, we're scared of that. Why? Because there are certain physicians out there, very gifted physicians, who they get sent all the tough cases. If they keep taking those tough cases, their statistics are not going to look good because they're taking tough patients. Their outcomes might not be as good because they're dealing with tougher circumstances. They're not going to look as good on paper, and they're going to be penalized for it. Again, good intentions on the part of an insurance company or the government that's going to have very serious and undesirable repercussions and consequences. So yeah, tort reforms really would be very helpful. To be honest, what I think is going to be the most important thing was exactly what Charles was saying yet again, is health savings accounts and catastrophic medical insurance plans. Medical insurance should be more like life insurance, like auto insurance. It should cover those unforeseen circumstances. We shouldn't be using our medical insurance to pay for routine little things. If we can get a catastrophic policy that costs $100 a month instead of $400 or $500 a month, all that money we save we can go into a health savings account. We can use that money to pay for our routine checkups, our routine x-rays, our medications. It's a much more sensible way of financing medical care. To be honest, I think all our problems right now are because we're financing our health care, our medical care, with other people's money. And what happens is, you know, the medical profession, the medical industry is not immune to the laws of economics. The laws of economics state that you've got to have supply and demand coordinated through prices. And we have a shortage of physicians because we don't know how much things cost. When was the last time you went to a doctor and asked him how much this test would cost? I don't do it. Nobody does it. But when we go to the supermarket, we're very keenly interested. And if something's more than we want to pay, we don't buy it. And then they have to bring the price down. It gets adjusted. And with the third-party payers in medicine, it's really created an environment in medicine where things are too expensive. There's not enough of it. And people don't know how much they're paying for anything. It's chaotic. And the government comes in and sets these fee schedules. And so that's the problem we have right now. We need a strong dose of reality, which comes from the free market.
Let's talk a minute about what Charles brought up about the health insurance companies and how there's only really two here. There's, of course, HMAA also, and I think University Healthcare, UHA. So how much of a problem from your perspective does that create for your patients where it's really expensive to get, for example, HMAA? A month. And
again, it's prohibitively expensive.
Right.
And what you have is you have a lot of healthy young families who don't consume a whole lot of health care. And it sounds crazy. They're essentially financing the health care for those who are consuming a lot of it. And so, again, dealing with a few insurance companies, that is a problem because the competition's not there. To be honest, I've had issues with when outside mainland companies come in, and I won't name any, but they're actually, I really would rather deal with HMSA, UHA, HMAA, these companies that are based here in Hawaii. They answer their phones. They're from here. They have a vested interest in the community. They're just easier to deal with. So I'm very happy that most of my patients have insurance from companies that are based here in Hawaii. Yes, competition is very good, but I think the primary difficulty is, again, the way we have it set up, that these insurance companies feel like they have to pay for every little thing. Every bit of money has to go through these bureaucracies, slowly filter through, and a little bit trickles out to the hospitals, the pharmacies, and the physicians. And I think that's the biggest problem that we face right now.
But one of the issues, I thought Charles's idea, which about crossing interstate lines, and that's something we've heard before. That's an idea that's been brought up. You're saying it is probably more difficult to deal with, but that might bring the price down.
It probably would.
Well, I just real quickly what I want to explain to individuals now. Nobody likes to deal with your insurance company. I don't know anybody who rolls out of the bed first thing in the morning and say, "Gosh, I really want to deal with my insurance claim today."
Right.
But if you have to, you would rather have an insurance market which is robust and competing for your business. The auto insurance market, which is by no means perfect, but anybody can't go a day without seeing an auto insurance company aggressively competing for your business. I mean, whether it's Geico or Farmers or Allstate or State Farm, they're out there and they want your business. But here in Hawaii right now, unfortunately, for health insurance, 90% of all health insurance is provided by just 2 companies. That's not providing aggressive competition between the insurance companies. And then for both patients and medical doctors, that's unhealthy. For doctors, it becomes a one-size-fits-all. You have to accept HMSA, and if you don't like it, you're out in the cold. For patients, well, you unfortunately don't have a lot of alternatives. If you want a more creative insurance plan, if you have some unique health concerns that you want addressed, again, it's one size fits all. That's not good for the people in Hawaii. That increases prices, decreases the quality of healthcare, and again, is why I feel it is so tragic that we have missed this great opportunity to find a right way to reform health insurance instead of this bureaucratic monstrosity that we now have.
So we only have about 2 minutes left, but what do you see, maybe you can each take a minute and see what you think is the future of your, so why don't we start with you, for your future of your profession, and you can wrap it up.
Well, people always need physicians, and there are always good people out there. I see all these kids who are fighting tooth and nail, clawing their way into medical school. They still want to be doctors, and I hope that the profession is preserved, and I hope that physicians can still practice medicine as they see fit. It is the most cost-effective way. Charles is right. Your medical care is between you and your physician. We don't need the government sticking its nose in. These are a lot of what we're seeing with regard to the Affordable Care Act and all these laws that are being passed. There's a certain road that is paved with good intentions, and we are hurtling down that road. And I hope that our leaders and our patients and my fellow physicians really get a good view of what's happening here and look beyond the good intentions and look down the road and see what the results are, and decide that it's far better for the patients and the physicians to be in control than the government.
Wow, that was exactly 1 minute. You're made for broadcast. You should be a broadcaster. Charles, go ahead.
Well, Malia, I could give you a much better answer on November 7th, the day after the election.
All right, we'll do another show.
But no, really, I think it's all going to come down to what the American people say, what the voters of Hawaii say on November 6th. Whether or not we're going to have this bureaucratic monstrosity continue, and unfortunately I think over the long term see higher prices and lower quality of care, or whether or not we decide that we need to change the status quo, change the direction of Washington, and really improve healthcare the right way. And that's all going to be decided by the American people and the voters.
So are you going to be having a debate with Colleen Haunapusa,
I look forward to it.
Congresswoman? Everybody's been talking about all these other debates, but when is your debate?
I very much look forward to it, Malia, and we have 4 months. I'm eager to engage on the issues.
I think that'll be a hot topic, healthcare, for sure. Well, thank you for joining us today. Our viewers, I'm sure, got very educated on the issue, and we'll have another show again, November 7th. All right. This has been News Behind the News. Aloha.